So yeah, a lot of people ask me, what's the downtime after a particular surgery? When you think of downtime, I think of it this way. It's the time during which you don't want to go out even to run a simple errand. Let's say that you had a rhinoplasty and you are thinking about the next time you need to go to the grocery store, for example. Well, when is that time where you're comfortable after surgery with going to the grocery store and feeling like, oh, people aren't really looking at me, thinking I had something done to my face or anything like that? With rhinoplasty, for example, you generally have the dressings on your nose right after surgery, and they stay on for about 6 to 7 days afterwards. And during that time, you're kind of feeling wiped out, not feeling the energy to go out to run any kind of errands or do any kind of chores. To that effect, downtime to me means just staying at home, not doing much. The downtime, it's the beginning phase of the recovery. And so when people think of it that way, downtime is relatively short when it comes to facial surgery. And that includes eyelid surgery, rhinoplasty, facelift surgery, fat grafting, and the like. The blanket statement that patients often hear is recovery takes about a year. And this can go for most types of facial surgery, especially rhinoplasty and especially facelift surgery, that the complete healing process or recovery process takes upwards of a year, sometimes give or take a month or two. The common misconception is that, oh, I'm never gonna look normal until that year mark. And that's completely not true. So if you think about it, if you're getting from here to your final endpoint, there's a good amount of change in terms of the swelling during the first 3 to 4 weeks. After that, that last 10 to 20% of the healing process is what you may notice in the tiny details. So when you look in the mirror first thing in the morning, let's say 3 to 4 months out after your rhinoplasty or after your facelift, you may see a tiny difference here and there from the night before or the week before. And so that's that last 10 to 20% that you see ebb and flow for upwards of a year. Now, in the grand scheme of things, those tiny differences that you see day to day, week to week, they're a part of the healing process. But in terms of feeling like, oh, I look presentable, I can step out in confidence in my newfound beauty and my newfound appearance, that is still here in terms of, hey, I can step out into the world and feel more confident about my beautiful self. So yes, the healing process, that last 10 to 20% can take the vast majority of the recovery time, but that initial first few weeks, that's where the most ebb and flow happens. And so the day-to-day of, oh, my nose is swollen, or my nose is a little less swollen today, I feel stuffy today, those kinds of things are more noticeable. So if I had a rhinoplasty, I would probably wait till after the first post-operative visit where my dressings are removed and everything's checked on by my surgeon to say, hey, everything's going well, the cast comes off, and the healing is still continuing, the recovery is still continuing, but at the same time, the downtime's kind of over. Based on my experience, I have a general idea of how the recovery and downtime process are going to go. There might be special considerations when it comes to your anatomy, when it comes to your health, and so that's something that we can discuss more in detail during your consultation as well.